Good, okay. Good afternoon. My name is Sébastien. I'm from Roche, working for 10 years now in Roche in different roles. My current role is GTIN coordinator, and I'm responsible for the product identification using GS1 identification keys. So in my presentation, then next 15 minutes, I will try to explain you my view on single unit coding from our manufacturer's perspective, to explain to you what we have done so far and the progress we've made, but also to explain to you the constraints and the roadblocks that we are facing and some ways to get out of these roadblocks. At Roche, we have a couple of experience in single unit coding, and I will tell you the different experience we have had in the last years. So we have here in the room Peter from Amgros in Denmark, and there was a requirement, and there's still a requirement actually from Amgros to apply barcode on primary packaging to identify the single unit. So we have done that with the exception of blisters. I will tell you later. Then we have also experience with, on the Swiss market, we have implemented for all injectables a GS1 data matrix on all the labels, and as well for the European Union, for all the countries, on centrally registered products, we have also a GS1 data matrix barcode containing a GTIN on our label, vial labels for solution for infusion. So how could we manage implementing these cases? I think it's all about collaboration and also leveraging opportunities. Let's have a look. So in 2010, we were facing technical issues on some of our vial labels. And this was an opportunity, since we were redesigning the formats, to include a GS1 data matrix with a GTIN on the label. I will show you an example just afterwards. And as a result, now we have 65% of our SKUs that have, for vials, that have a GS1 data matrix on the label. In 2011, we collaborated with GS1 Switzerland to implement the GTIN in GS1 data matrix on all injectables for the Swiss market. And I also want to say that this was the result actually of a great collaboration between hospital pharmacists and industry and GS1. So we were signing a joint recommendation to implement and provide guidance for the implementation of data matrix at the single unit. And also a great opportunity I want to raise to all the manufacturers also in the room: take the advantage when you are refurbishing your lines for serialization. At the same time, add a single unit printer on your line. So that's what we did. I'm sure we will not regret it because I'm sure we saved a lot of money by doing that. And we are prepared, at least from a technical equipment aspect, to fulfill single unit coding in the future. At the moment, we have 60% of our lines that are equipped with such printer, 90% of our label lines, so vial labels, syringe labels, bottle labels, and 20% of our blister lines. So here you see how we redesign our label. Before redesigning the label, so we had here quite an odd barcode, only for internal use. It was just to identify the label on the packaging line to make sure we're not mixing up labels and the label was coming on the right vial. but actually it has no use for the end user in the hospital. So what we decided to do when we redesigned, we put actually this internal barcode outside of the label on the label carrier. And instead of this barcode, we implemented the GS1 data matrix with GTIN. And that's why we could implement so many of our vial labels with GTIN on data matrix. How is now our approach in regards to single unit coding? So we don't have the same perspective as a hospital. Our perspective is more a technical one, so we are looking at technology, at complexity of technology implementation to define our approach for single unit coding. So we divided basically the technology into labels and blisters. And then on the other side, on the complexity of the barcode, one element, static. This means you can put it on the artwork, pre-printed, or 3 element variable, then it's batch specific and you need to print on the line. So we define different blocks. We have 4 different blocks that we want to manage separately with different strategies. For GTIN only static on labels, that's the only measures that we have implemented so far. It's quite easy to implement if you have enough space on your label, so if your label format allows it, and the text font size allows it. So we could not implement for all countries, because we have countries where there's so much text required by the authorities that we have near no space free to add a 2D data matrix barcode. We also have some font size requirements from the authority that tells us you are not allowed to go smaller than 5-point font size. And then it's very difficult to add a readable data matrix barcode on the label. However, we could manage to implement already now 35% of all Roche labels. For vials, it are 65%. When we speak about adding variable data, this gets a bit more complex because you need to have an online printing equipment on your line in order to print the data matrix online with GTIN expiry date and batch number. Of course, you must check that your label format and the text font size is fine and that you are able to add the barcode and you have enough space to print it. In terms of capability at Roche, now we have 90% of our lines for labels that are able, technically, that have a printer that can print GTIN expiry date lot number on labels. When we speak about single unit blisters, then it gets really more complex because we have other technical parameters to consider. So, of course, if you only want to have the GTIN, you don't need to have an online printing equipment because it's part of the artwork of the blister foil. However, you also need to check your format, that blister cavity are big enough to allow to put all the text required per cavity and also the barcodes. More challenging is a change of the leading foil material. Because you know, most blisters, they are on aluminium, they are very shiny. If you start printing, if you want to print a GS1 data matrix barcode and want to read it, you will have problem with the reflection. So this is quite tricky, and if you don't have already the right material on your line, on your blister foils, and you need to change this, there's quite a lot of change. And this requires quite substantial investment until you get it there. And finally, the most complex is actually to have the GTIN plus variable data on the blisters. So there you need the online equipment. You need to make sure your blisters are adapted to have the barcode on it. You need to make sure that your leading foil material is anti-reflective. And finally, again, we have here in terms of equipment, we have 20% of our lines that are able to print a data matrix online for blisters. I would like to give some practical examples of the technical constraints. So first of all, you have very small containers. Look at these small ampules. You see it has, so we have implemented a GS1 data matrix on these very small ampules, but you can imagine how small the text on the ampule label is. I will show an example later. So this is very tricky, especially if the diameter of the ampule is very small, then it might be difficult to read the barcodes because of the rounding of the container. Also, we are struggling very much with the blisters. We are trying to do a lot of tests at the moment with printing GS1 data matrix on blisters, also including variable data. So we have here an example for Unibase for Greece, and we made a test and we sent it to GS1, but unfortunately the barcode was not readable. So we must continue doing some tests, and most probably we might have to change the material of the leading foil, which is a big change. But this is the solution to go, I think. That's where also I want to say to the manufacturers in the room, work with your GS1 contacts that will help you achieving the right quality before you put the barcodes on the market. It's very important that we're not just implementing the barcodes like this. We need to collect some experience, especially if we are working with this type of materials. Make sure that the barcodes are being certified readable by GS1 before you implement finally and you send it on the market. Here we have also some challenges with the amount of text and font size when we speak, for example, about Belgium or Switzerland that have 3 required languages that must be on the pack. Then it can be very difficult to add a barcode on top of that. Here I have really an extreme example. It's a Konakian 10 milligram ampule label. It's very small. You will see on the next slide the dimensions. But we included JSON data matrix barcode that looks quite big actually, but it's the proper size to be readable. It's for Denmark, so for the gross requirements. As a result, you can see how small the text was getting, 3.25 point, and this is hardly readable by anybody, by any nurse or pharmacist. Other technical challenges or user expectations that might be difficult to fulfill. Here we have a syringe with a safety device. And the safety device is transparent, and below that you have the actual label of the syringe. And when we print a GS1 data matrix, we print it, of course, on the label. The problem is the nurse is not able to scan the barcode with the safety device on. The nurse needs to remove the safety device first in order to scan. And in some processes that Lieve was explaining, this might not be the process of the hospital. So here again we have a problem because of the safety device that needs to be considered. As well, we also might not meet the expectation of the users. Of course, when I have a GS1 data matrix on a battle label with 50 tablets on it, my GTIN means 50 tablets. Now we have to make sure what is the user expecting, to have 1 tablet when it scans. The same with multi-dose vials or with non-single unit blisters. If we have a blister that you cannot cut into single units or single doses, then the GTIN will apply for the full blister. I was speaking about this small ampule vial. Here you see very, very small, 32 per 18 millimeters. We have a barcode, GTIN data matrix, great. The hospitals would be happy, the nurse would be happy, but I might have hospitals on the market that cannot read the GTIN data matrix, and they might need, or they need the text in order to make their controls. What happens if they cannot read the text, or the text is so small that you might also do some errors? And on the other side, we have some customers or hospitals who say, I want to be able to read the barcode. So we have a dilemma here that we need to solve, and only with a consistent message from the users on the markets, we are able to move forward with implementation. Otherwise, we'll get always in this dilemma between different requirements. Also, we'll need to work with the health authorities to help us solving this dilemma, making them aware of the importance of the GTIN data matrix barcode to allow the safe administration of medicines. But of course, then we have to make concession to the font size of the text, because we cannot just increase the size of the MPUs like this. In terms of internal challenge and roadblocks for further rollout, as far as we're concerned, we need to solve some technical issues before we move forward with all the products. So we might need new label formats. We might need to change the material of our leading foils, and this requires substantial investments to be solved. We also, I mentioned that we have already quite a lot of lines that are equipped with a printer for single unit. Doesn't mean that tomorrow we can just print the barcodes. We also need to implement everything that is around it. We need to have surrounding processes and systems like IT, master data, label change management be in place to allow this to happen. And last but not least, in a lot of manufacturers, technical projects are competing between each other. So we have actually also a single unique coding project that is now in the pipeline to move with all our portfolio on single unit coding. But of course, it's competing internally in terms of resources and budget with other projects that might be directly compliance driven. And there, it's difficult for us when we have to prioritize projects to make them more, given a higher priority if they are not directly compliance or regulatory driven. However, I see a lot of opportunities, a lot of chances that we need to take, and a lot of hope for the future. I will tell you why. Because first, by advocating for the use of GS1 standards, we are already having a technical solution that makes it, I think, very easy and very straightforward to implement a single unit coding. We need to find a common and strong position. I think this is moving forward on this topic between industry and hospital associations. Essentially, we must make sure that users are very clear about what they are asking, about what they need, and to make sure that there are harmonized recommendations. And GS1 is actually the ideal platform to discuss on this topic. I was very happy this morning when I heard the presentation from Robert from the Netherlands to see that they were actually now developing a harmonized guidance on how should be the requirements for single unit coding. This is actually exactly what the manufacturers need, and we hope that this kind of developments will also extend to the whole of Europe. We'll need to engage with health authorities to increase their awareness for the importance of point-of-care scanning and help us solving the dilemma we are facing with the labeling. We see more and more leading hospitals in the world introducing barcode requirements for tender orders. I mean, this is exactly what happens with AMGROS as a procurement organization. We see hospitals in other countries, leading hospitals that are completely digitized, and they would say, if you don't barcode your products on single unit will not buy them, this is a strong incentive for manufacturers to move on. And finally, we see also regulators all over the world to be receptive and starting discussing requirements for single unit coding. And I can tell you this is what will make manufacturers moving. And so we are looking at the developments there. We must make sure that they are harmonized, that the GS1 standards are being used. And then I'm sure we'll move forward quickly and continue the journey we have started so far. Thank you for your attention. I will be happy to answer your questions later.